Hello, this is Katie Du Bois doing my case study on hypertension. In this case study, the medical examiner's office informs you that they are investigating the sudden death of one of your patients. The patient was a 55-year-old black woman who had been followed for many years in the hypertension clinic. The patient had no previous evidence of renal disease or endocrine abnormalities. On a recent visit, her blood pressure was 190 over 105, and a few months ago, she was briefly admitted to a hospital after she awakened at night feeling short of breath. On the last hospital admission, records show that she had mild ankle edema, basilar rales, and hepatomegaly. The chest X-ray showed cardiomegaly and a slight atrial enlargement. Her EKG confirmed left ventricular hypertrophy. Her lab study showed slight hepatic damage, serial cardiac serum markers, enzymes, troponins were all negative for MI. Over the last few years, there had been a steady increase in her serum BUN and creatinine. The medical examiner relates that the patient complained of sudden, severe, sharp chest pain and collapsed at her husband's softball game. The patient was found to be hypotensive with unequal pulses. The chest X-ray revealed a left pleural effusion and a widened mediastinum. An autopsy is being done to determine whether she died from some catastrophic vascular event related to her hypertension. For this case study, I chose 3 articles related to hypertension. The first article describes the pathophysiology and long-term effects of chronic hypertension. The second article describes how nutritional and lifestyle changes can affect hypertension. And the third article describes how aerobic exercise affects blood pressure. I chose these 3 articles because I believe that it is important to teach the patient lifestyle modifications and the importance of diet before only trying to resolve hypertension with medications. So the hypertension pathophysiology. Hypertension affects 75 million adults in the United States. Hypertension is defined as systolic blood pressure of 140 or more, or a diastolic blood pressure of 90 or more. Hypertension may be primary, which may develop as a result of genetic or environmental causes, or it can be secondary, which is caused by renal, vascular, and endocrine malfunction. Primary hypertension causes 90 to 95% of adult cases, while secondary hypertension causes 2 to 10% of cases. The prognosis of chronic hypertension. 30% of people develop atherosclerosis. Ischemic heart disease or stroke increases as blood pressure increases, 3.6 to 19.2 times higher in people with hypertension. Hypertensive retinopathy, end-stage renal disease, coronary artery disease, which is 2.3 to 6.9 times higher for people who are hypertensive, and congestive heart failure, 2.3 to 3 times higher in people who are hypertensive. The relationship between nutrition and blood pressure. A research article by the American Journal of Hypertension evaluated and quantified the association between modifiable lifestyle behaviors, dietary intake, and blood pressure. Results concluded that systolic blood pressure was higher in individuals with elevated body mass index, and a higher BMI was considered the main contributory factor that was modifiable, a blood pressure level after multiple adjustments. Salt intake was associated with increased systolic blood pressure in men, but not as much in women. Increasing intake of fruits and vegetables decreased systolic blood pressure in men and women. And finally, alcohol consumption increased systolic blood pressure in both men and women. Effects of aerobic exercise on hypertension. In a research article by the American Heart Association, 50 individuals were randomly assigned to participate in an 8 to 12-week treadmill exercise program to determine if aerobic exercise can decrease resistant hypertension. Their research shows that aerobic exercise on a regular basis is a helpful adjunct to control blood pressure and should be included in the therapeutic approach to resistant hypertension. The exercise program significantly decreased both systolic and diastolic blood pressure on exertion and increased physical performance as assessed by maximal oxygen uptake and lactate curves. Physical exercise made improvements in lowering blood pressure in individuals who have a low responsiveness to medications, and physical exercise should be included in decreasing resistant hypertension according to their study. Putting it all together, so the patient was previously hypertensive with a blood pressure of 190 over 105. The patient also had signs and symptoms of congestive heart failure. The patient had an increase in her serum BUN and creatinine over the last few years, which kept trending up. The patient collapsed after having sudden severe sharp chest pain followed by hypotension, unequal pulses, and left pleural effusions. Unfortunately, this patient's chronic uncontrolled hypertension and congestive heart failure with cardiomegaly led to catastrophe of a vascular event. Changes in lifestyle, including diet, exercise, and medical treatment, can help to decrease blood pressure to prevent the detrimental effects of chronic hypertension. This patient should have been followed more closely to monitor her blood pressure, had some medications adjusted along with lifestyle and dietary modifications that could have prevented this from happening. She had a lot of signs and symptoms that were suggestive of congestive heart failure, which weren't necessarily followed up with either.